Well, welcome to my channel, Act on Mental Health. My name is Sean, and I'm a licensed mental health counselor here in the state of Indiana. In today's video, we're discussing anxiety and how ACT aims to help us to effectively manage our symptoms by targeting our values. Now, for many years, I struggled with anxiety but didn't know it at the time. I found myself being pulled every which way that my anxiety blew. It was really difficult for me personally because I didn't really know what was going on. I just would get wrapped up in rumination over the past and what happened, or I'd get wrapped up in worry about what could happen in the future. And a lot of it was directed toward how people felt about me or how I perceived that people felt about me. I wanted to make people happy and I wanted to please them, which is a value of mine, is to help people. But anxiety really threw a wrench in that value. And it was hard to explain to others why I can be really motivated, on fire, and throw myself into work one moment, and then cold and disengaged and kind of struggling to find motivation the next. And a lot of this had to do because I wanted to please people. And so when I felt people were happy around me, it just led to a lot of increased motivation and energy. But when I felt like people were not happy with me, well, then I tended to kind of retract a little bit and disengage because I didn't want to displease anyone. ACT played a major role in helping me to get out of the hamster wheel of anxiety, always trying to please everybody until exhaustion hit. Now, anxiety is different for people, but there are some common features that help clinicians at least to determine if this is a mental disorder or whether or not it meets criteria. Now, there's anxiety that leads to dysfunction, and then there's everyday anxieties that everybody tends to manage the best that they can. What I'll show you in this video works for both types of anxiety, so you don't need a mental diagnosis to take full advantage of ACT and these exercises and techniques. This video is broken down into 3 sections. First, we're going to look at understanding anxiety from an ACT perspective. Second, we're going to look at some ACT techniques for immediate relief. And then third, we're going to look at avoiding fear and anxiety at all costs and what that does to our pursuit of our values. Now, a new feature that I'm adding to this video is a rating scale that's downloadable and free to use. It's called the Workability Scale, and something that I've created to help provide a visual aid as well as help my viewers to self-assess their current levels of anxiety and willingness and whether or not these exercises provide immediate relief. So feel free to download the resources now and come back to it later in section 2. I'll give you more instructions then, but for now, let's look at anxiety from an ACT perspective. In the world of mental health, anxiety disorders take a significant place, and a considerable amount of resources is spent on addressing anxiety issues. In the book, ACT for Anxiety Disorders, the authors cite research from Barlow in 2003. He found that those diagnosed with an anxiety disorder spent twice as much money as those who address other mental health concerns. So with all the money being thrown at anxiety disorder, we've solved the problem, right? Well, not so fast, but we have understood anxiety a little bit more over the last 20 years. So let's break down anxiety. It's like a strong feeling that we all know called fear that happens when we sense danger, whether it's real or something we imagined. This fear can come from things that are happening around us or something going on inside of us, maybe a gut feeling, a thought, or a memory, or a mix of both. When we feel fear, our body reacts quickly. Our heart is racing, our breathing is faster, and we become ready within seconds to either run away or run towards whatever is causing our fear. Our attention zooms in on that scary thing, making us hyper aware of it. Usually fear is helpful because it pushes us to act and protect ourselves. Now let's talk about anxiety. Anxiety is different than fear. It's like a mood that sets in, and it's all about worrying and feeling tense. Unlike fear, it's more about what might happen in the future. People who worry a lot, chronic worriers, don't show as much physical reaction as those with specific fears, meaning they're not hyperreactive to their surroundings. Instead, they're kind of tuned out and they're inattentive because they're thinking about what could happen instead of what's happening in the room. Anxiety is often less intense physically because it's more about thoughts and words than what's happening right now. Anxiety-related behaviors are mostly in our thoughts. We may ruminate about the past, something we don't want to happen again, or we might worry a lot and make plans about the future. Fear, on the other hand, leads to actions like running away, fighting, or freezing. In ACT, every thought, emotion, and behavior makes sense to the client. Rather than pathologizing every symptom, ACT practitioners will ask, what's the function of this anxiety? Similar to fear, anxiety's function is to move us away from perceived danger in the future. Fear and anxiety have their roles. Fear is like an alarm that makes us stay safe. Sometimes it's automatic, like ducking when something comes flying at us. Other times it's learned through language. Someone shouting, "Danger on your right," makes us jump left. Even worrying about the future threats can be useful. It helps us plan and prepare, like a family creating a fire escape plan for their home. So experiencing fear and anxiety is often a normal and healthy part of life, helping us stay out of trouble and alive. Now, why does anxiety become a problem? Well, according to ACT, it's avoidance that turns anxiety into an issue. We'll delve deeper into this later on in the video, but for now, armed with this understanding of anxiety, let's take steps to deal with it. In the description below, you'll find a downloadable resource that will include a pre and post rating scale, so you can see if there's a difference in your anxiety. Now, this is something that you can use the next time you try an ACT exercise to evaluate, does it work for me? Obviously, ACT does not promote symptom reduction as its overall goal. Rather, it's acceptance of reality, no matter what thought or emotion shows up. However, workability lies at the foundation of ACT core processes and inform therapists and clients on whether or not this technique is working for you or not. The research literature has consistently found that exposure is the best technique for fear-related disorders. For example, for specific phobias, a therapist may use an exposure technique to help a client to rate from 1 to 10 feared scenarios for their specific phobia. For spiders, the least feared scenario might be a picture of a spider, and most would be holding a spider in their hand. A therapist would then go from 10 to 1, gradually weakening their fear response, and in some cases, curing specific phobias. In this section, I will describe a number of commonly used exposure exercises that bring people into contact with feared scenarios and gradually weakening their fear response. Anxiety is similar to fear, but it's displaced from the present and is future-oriented. The idea of exposure is that by bringing feared images of the future into the present, we can successfully treat anxiety as we do with phobias. Now, you're welcome to do all of these exercises. However, in ACT, the choice of exercise is often determined by which exercise is most similar to avoidance strategies a client uses. So if you find yourself saying, "I would hate to do that exercise," then that's probably the one that you should do because you're naturally wanting to avoid it. Does that make sense? So unlike coping strategies that teach us how to cope effectively with symptoms without resorting to unsafe or problematic behaviors, exposure strategies bring us into contact with the very thing we're trying to cope with. And it's a very counterintuitive process, but makes a lot of sense once you try it and once you see the proof of it. Now, I'm going to ask you, before we begin, a very ACT question, and that is, are you willing to come into contact with your anxiety to find immediate relief? If the answer is yes, then let's proceed with the exposure exercises. Now, if we were to set this up in a therapy room, I would spend a lot of time trying to get to know your anxiety and help you to create an image of what it would be like to feel that anxiety. So for you, it may be putting yourself in a situation, that's kind of like a worst fear. For me, when I would preach, my biggest fear was actually going up there and having no notes and nothing prepared and having to just talk. So that anxiety of not being prepared was actually very, very real for me. So that's an image for me that just helps me to come into full contact with that anxiety. Now, for those with specific anxiety disorders, I'll include some images for you for each of these anxiety disorders to help you to put yourself into that role. But feel free to kind of pause the video and maybe come up with an image or a situation that really fits your anxiety. So for panic disorder, the image would be suffocating and writhing on the floor. For social phobia, it might be being jeered at or criticized by a group of people. For PTSD, it might be being abused or reliving the trauma. For generalized anxiety disorder, or GAD, being found out as a sham or incompetent. For OCD, doing something violent, obscene, or blasphemous. These exercises are referred to as FEEL exercises in the book Act for Anxiety Disorders. FEEL stands for Feeling, Experiences, Enriches, Living. These are designed to be practiced 20 minutes a day in between sessions with a therapist. For our purposes, I'll briefly describe each one, and then you can make it a goal to set aside about 20 minutes to practice these. Now, each of these can take about a few minutes, so feel free to use one that works for you or use a few of them to fill that 20 minutes. The first one is spinning. The first exercise can take several forms and is designed to diffuse fearful reactions evoked by the sensation of dizziness and vertigo. Such exercises may include spinning in an office chair, spinning while standing, or placing your head between your knees, then suddenly moving to an upright position. The next is hyperventilating. This procedure involves voluntarily paced overbreathing and is capable of inducing panic attacks, including dissociative symptoms in some individuals. This occurs in part because oxygen is inhaled at a rate greater than the metabolic demand, leaving too much oxygen and too little carbon dioxide in the blood. To do this, you will breathe through the mouth at a pace of about 1 breath for every 2 seconds and continue with this procedure for up to 3 minutes. Once you are beginning to feel the effects, you can discontinue the exercise. The next is breathing through a small straw. For this exercise, find a straw, or if one is not available, you can form your lips like there is a straw there. The nose should be pinched closed with one of your hands while breathing through a straw for 30 seconds or more. This exercise evokes breathlessness and sensations of smothering and can be combined with other exercises in this section. The next is breath holding. Breath holding involves holding your breath for a period of time. The duration of breath holding can be increased in a gradual fashion to increase diffusing from feared responses. This procedure typically evokes broadband cardiorespiratory sensations, and specifically the feeling of suffocation or air hunger. Anxiety tends to show up in the body just above the heart and upper lungs. Thus, this exercise creates a similar condition. The next is climbing steps or step-ups. These exercises and their variants, for example, fast walking or jogging in place, these evoke cardiorespiratory sensations and more widespread sensations of autonomic arousal associated with physical exertion. Basically, you're getting a good workout in a very quick manner. So you could do modifications of this where you find 1 or 2 steps and you go up and then go down, go up and then down, or you could go up a couple flights of stairs. But this is something that'll get you in touch with that sensation of a physical exertion. The final one that I'll mention is staring at self in the mirror. This exercise involves simply looking at yourself for 2 minutes in the mirror. The procedure typically elicits feelings of derealization, or you feel like you're not quite sure if that's really you that you're looking at, or if you're looking from your perspective. And so it can kind of be a little uncomfortable for you. But that's exactly what you want to encounter if that's part of your anxiety symptoms. Now choose 1 or more of these exercises and try them out. You can set a 20-minute timer if that's helpful, and then you can continue with the video, or you can just come back to this after you're done with the video. There's growing evidence in the research literature suggesting that the main challenge for many individuals with anxiety disorders isn't necessarily the intense fear or constant anxiety they experience. Instead, the issue often lies in their overwhelming tendency to avoid facing and experiencing these feelings. Their lives become consumed by the constant effort to dodge anxiety, fear, unwelcome thoughts, memories from the past, and worries. This avoidance-driven lifestyle can manifest in a variety of ways, such as steering clear of people, places, activities, in situations that might trigger anxious and fearful feelings. Some might turn to substances to numb these emotions, while others may resort to escaping from situations when faced with unpleasant emotional states. Most of these avoidance behaviors are constructed through language, involving evaluation and verbal processes. This is why, according to ACT, language is at the core of this experiential avoidance problem. In the ACT perspective, anxiety and fear become problematic when individuals are unwilling to experience these emotions, habitually engaged in actions to avoid, suppress, or escape from them, and invest significant time and effort in this struggle, neglecting other valued aspects of their lives. Ironically, the things that we feared the most and avoid tend to become the life that we create for ourselves. In behavioral psychology, this is referred to as a feedback loop of reinforcement. Reinforcement strengthens the behavior, making this feedback loop more difficult to break or deviate from. ACT offers unconventional techniques to diffuse ourselves from this feedback loop, to regain our ability to choose a life according to our values.